It's time for News 2 at 5 with Stephen Clark, Dana Tyler, Mark Dannon with weather, and Warner Wolf on sports.
Mastectomy doesn't have to be a scarring and disfiguring operation anymore. Last night at 11, we introduced you to a woman with breast cancer as she prepared for a breakthrough operation. Well, today she's recovering from the surgery that removed her breast but also gave her a new one. News 2 reporter Emily Francis went inside the operating room. She joins us now live from St. Luke's Roosevelt Hospital with details.
Hello, Stephen. The woman is out of surgery, and we're told she's recovering extremely well. Instead of having a disfiguring scar, she has a brand new breast with real tissue. And the good news is within 5 days, she'll be leaving this hospital and going back to everyday life. Last night, 44-year-old Susan Palmer was packing, not for a vacation, but for a trip to the hospital.
It's going to be painful. I said, all right, I could deal with pain as long as the outcome is really good.
This looks great. It's coming along very nicely.
This is Susan Palmer today, on the operating table for 5 hours of breast cancer surgery.
We'll tunnel right on up until I can actually get my fist right underneath there.
Wow. Doctors at St. Luke's Roosevelt Hospital are performing a breakthrough procedure. It combines a mastectomy with a technique called a tram flap reconstruction. In the past, doctors would use a scalpel to perform mastectomies, which would leave a very noticeable scar across a woman's breast. But what makes this procedure unique is plastic surgeons use facelift scissors, which make a very small incision. That not only saves the skin, but also minimizes the scar. By saving the skin, Dr. Antell can then reconstruct the breast with fat tissue from her abdomen. He makes an incision in her abdomen, builds a tunnel to her breast area, and then moves the fat to rebuild her breast.
It's still attached by that muscle, and that muscle feeds that soft tissue so that it can survive.
For Susan, this procedure could be the difference between life and death. 3 years ago, CBS News was with her right before undergoing a lumpectomy for breast cancer. There was only a 1% chance of it coming back. And you can see she was part of that minority. If she underwent another lumpectomy instead of getting this surgery, chances are the cancer could recur a third time.
Given that it's there for me now and with my circumstance, with a mastectomy, I think it's the best for me mentally, and I think women should know that it's out there.
The good news is that this technique is becoming mainstream, and a federal law that was proposed by former Senator Alphonse D'Amato requires insurance companies to pay for the $25,000 surgery. Now, there is good news and bad news as far as the side effects of this procedure. You do get a tummy tuck in the process because that fat is what is going into the breast tissue. However, it can be painful for some time. Reporting live from the West Side, I'm Emily Francis, News 2.
As she put it, though, if it's a little painful, as long as it's in the end, it fixes everything she's having.